Welcome to Healthy Cleveland. I'm your host, Leah Haslage. Today's topic is HPV. With us is Director of the Department of Cleveland Public Health, Meryl Gordon.
Hello.
Hello. And Dr. Monica Webb Hooper, who is the Director of Office of Cancer Disparities Research at Case Western Reserve University. Welcome, ladies. Thank you so much for being here.
Thank you for having us.
Let's start off with, what is HPV? I know it's been out in the news, and I'm sure people in their doctor's appointments have heard this, but what exactly is it?
HPV is human papillomavirus. It is the most common sexually transmitted disease in the United States. There are about 79 million cases of HPV, so it's a very common virus, and when left untreated can lead to a number of health outcomes. There are, as many viruses, there are multiple strains of HPV, and some of these lead to genital warts.
You said sexually transmitted, so is that the only way you can get in contact with this virus?
Yes, it is a sexually transmissible infection.
So you can't get it from like just being on a toilet seat or other surfaces like tables and such, correct?
That's correct.
Okay. Now, how would you know if you have HPV? What are the symptoms?
Well, in many cases, the symptoms are relatively undetectable, but some people will experience symptoms such as discharge, irritation, and the outbreak of genital warts, which is very painful and very uncomfortable when that happens.
Are there any other symptoms like dizziness or flu-like symptoms?
No, not that I'm aware of.
No?
No, but as the doctor indicated, there are some people who actually don't have any factors that do appear, so they might go for years and not know that they have HPV and might be transmitting it to others.
As I say, you can be passing on from partner to partner. Mm-hmm. Now, what if someone's pregnant? Would that affect the baby? Would that affect them down the road?
It could possibly. Certainly, if they're having an active outbreak during the time of delivery, that would certainly be a risk for the baby that the doctor would be very mindful about.
Now, I know there's a vaccination, though, for this. So talk to us about the vaccination and who should be getting it.
So the vaccination is now available and has been available now since the earlier 2000s, middle 2000s, and it is our first vaccine for this virus, which is considered a huge public health victory, that there is a vaccine that can actually prevent many strains, not all strains, but several strains of HPV. And this is, it's recommended that children between the ages of 9 and 13 receive the vaccination.
Oh, wow. So why so young?
Well,
because we want to get to these young people before they're sexually active. We know that there has not been a cure, at least to my knowledge, of any virus or any viral strains. So the prevention initiative to inoculate them prior to them having any sexual interaction with another person, this inoculation essentially will help to essentially curb or perhaps stop completely the transmission of this virus to another human being.
And what's the age range to go up to get this vaccination? I know you want to start young, but how far up does this vaccination go?
The recommendation is age 21 for young men and young women, and up to age 26, particularly if men are engaging in sexual activity with another male.
Yes, but we're recommending that they get the vaccination as early as, is it 12?
As 9 now.
Oh, as 9
yes,
even.
as age 9,
oh, wow.
Which is the most recent recommendation this year from the CDC, late this year actually.
What do you say to parents that are like, my child is not going to be sexually active at this age, so I don't think they should get it? Or they're concerned about the vaccination because there's a whole thing with vaccinations now with parents and children. What would you say to them about the importance of getting this particular one?
That's a really good question, and I think the uptake of this vaccine is relatively low in the United States, and I think we were surprised about how few people would actually be willing to get the vaccine, and there are a number of concerns that parents have, and I think it's rightfully so for people to be concerned and want to really understand the pros and cons or the risks and benefits of any vaccination. I would say to parents that it important that they really look closely at the research available. They would find that this vaccine is relatively safe, that there are a few side effects that happen, such as, swelling at the site of the injection, maybe some irritation around that. There have been a few cases reported of other, but still non-life-threatening side effects, like maybe fainting if someone stands up too quickly after receiving the vaccination, that sort of thing. So I would say that in general, this vaccination is considered quite safe. It's been tested in clinical trials and approved by the FDA before it was administered. But that's one thing that I think people should certainly keep in mind. And I think that another thing that they should consider is that this is a major preventative tool. There are a number of sexually transmitted infections that their kids could be exposed to as they get older, and even if their child is abstinent and waits until they're married to engage in sexual activity, this would be something that still is an important preventive measure, because unfortunately, you don't know what could happen. And the same way we vaccinate our children for a number of things, to prevent them, to keep them healthy, to keep them safe, prevent them from contracting illnesses, is another reason that you would opt for this vaccine.
Well, when we return to Healthy Cleveland, we're going to discuss more about the HPV vaccination and what other preventative things it creates besides just some of these viruses. So stay tuned for more Healthy Cleveland.
They told me a bottle couldn't dream, that I would never become a superhero. But I learned how to fly, just to come back in a new disguise and be the hero that I've always wanted to be.
I love my sister.
My heart doesn't see race. Love is love.
Welcome back to Healthy Cleveland. I'm your host, Leah Haslage, and we are continuing our discussion on HPV virus, what it is and how to treat it. And with us is our guest, Director of the Department of Cleveland Public Health, Meryl Gordon, and Dr. Monica Webb Hooper from Case Western Reserve University. Thank you again, ladies. Now, we were discussing before break about concerns parents might have. Do you want to continue to elaborate on what in specific people need to know about just the risks and all of that comes with vaccination?
Well, a little bit less on the risk side is more of kind of what something like this might conjure up in a parent who has to make that decision at a young age for their child. So perhaps a parent might not be thinking about their child being a sexual person at age 9, 10, or 11. And so that the idea of even a sexually transmitted disease for their child, but prevention is about making sure that we're giving that child the best health for them to move forward and to live in this world and be a productive citizen. So our concern around this is is because the risks are so minimal, is making sure that parents really understand what this is preventing in the future. We know that between 70 and 80 million people in the United States have some form of HPV, which is staggering. So even if they do wait until marriage, you don't know about their partner and what that means too. And Dr. Hooper can talk a little bit more about the cancers that can result from having HPV. But our concern from the Cleveland Department of Public Health is making sure that children have everything available to them and every inoculation, every vaccination possible to make sure that we are preventing diseases in the future.
Because it's more than just one kind of cancer, right? And this affects males and females.
This does. I actually wanted to make one more comment about the age, which many people have the concern about starting this when they're thinking about a 9 or 10-year-old child. And I can certainly appreciate that. The evidence, however, is that the vaccine is more effective the earlier it is administered. So the earlier the better in terms of the immune response and possible and preventative the protection that it offers. So it's certainly better to start early, and then people can catch up as they get a little bit older and move into later adolescence, but the earlier the better with this one.
How many times do you need to take the vaccination? Is it a one-time deal, or do you have to go for multiple vaccinations?
That's a great question. So the recommendation up until this year was 3 by 13. So it's a 3-dose series, and that the first vaccination should start somewhere around age 10, and now down to age 9, but that should be concluded by 13. And the first 2 vaccinations need to be administered within a 6-month period, and then the third vaccine about a year later. And this was one of the early concerns that people had about the number of visits that they have to bring their child to have this vaccine.
Yeah.
There's a new recommendation, however, that only the 2-dose series is actually just as effective, especially when started earlier. So this would be just 2 vaccinations that kids would need to have. Hopefully that will increase the rates of people deciding to have their child vaccinated, but they certainly would need to talk to their doctor about their dosing and about which is most appropriate. And for kids who've already started being vaccinated, if they've already started the series, then they should continue and receive all 3 doses at this point.
And you had mentioned 21 is the age it kind of goes up to for vaccination, right?
It could go up as far as age 26.
Well, then what about the rest of us over 26? I'm in my 30s. Is there a way I can prevent HPV and various cancers from it? Is there something that we can do preventatively?
Well, around sexual health, sure. I mean, to really protect yourself is to make sure that that you're wearing a condom, or that your partner is wearing a condom, and that direct interaction in a sexual encounter is protected. But as we're learning too that HIV and other sexually transmitted disease rates are going up staggeringly in the youth cohort between the ages of 16 and 22 or 23, I believe. So we know that kids are having sex or sexually active, and so again, this is a really important step for parents to take, and so we really encourage that. Know from the data that this is a really important thing.
Another important point when you talk about that is that the concern, especially one of the earlier concerns, I think fewer people are concerned about this now, but certainly one of the earlier concerns with regard to sexual activity was that if you have your child vaccinated for HPV, that you would somehow be opening the door or giving them permission to engage in sexual activity. And so multiple studies have investigated this possibility, and there's no evidence that having your child vaccinated for HPV gives them permission or increases the likelihood that they would engage in sexual activity.
It's not encouraging them to
Exactly.
get started early.
Many kids are unaware of HPV. It's just the same way if you're going to administer MMR or, all the other vaccines that they receive, that the children often are unaware of exactly what these vaccinations are for. So that's not a concern that parents should have.
All right. Well, when we return to Healthy Cleveland, we'll discuss more about HPV and what cancers this does cause. So stay tuned.
I'm only 17, but I know about investing. Believe in something, buy shares in it, watch it grow. So, what if you could invest in the future? The future of kids, like a stock. Not the kind of stock that's about making money, but a stock for social change. A whole new kind of investment called Better Futures. When you invest, it helps kids go to college. I could be one of the first college graduates from my family, the first philanthropist from my neighborhood. And if I'm the first, then maybe there's a second and a third. Believe in us, invest in us, watch us grow. My name is Sydney, and I'm your dividend.
Welcome back to Healthy Cleveland. Now we're going to be discussing the cancers that the HPV viruses do cause, because it's more than one kind of cancer, and this affects both male and female.
So this is, we're very excited about this in the area of cancer prevention. This is the first vaccine that can prevent multiple cancers. And most people have been affected by cancer in some way. They know someone who's had cancer, a loved one, a family member, a friend. So cancer is something that we know is a major problem, and it's really, really sad and painful to watch someone pass away from cancer. This HPV vaccination is the first cancer prevention vaccine. And I will say that it doesn't prevent all cancers, but it does prevent multiple cancers that include, number one, cervical cancer, which is something that women may be diagnosed with, but then also other cancers like head and neck cancer, and several throat cancer, and several genital cancers as well.
Oh, wow. Because you said earlier, there's many strains of this virus.
Right.
How many are we looking at here? Are we talking about 40, or are we talking about 40,000 strains?
I don't know the exact number of strains of the virus, but there are multiple strains. With viruses in general, there's so many strains of it. But the strains that, if people were to be vaccinated, if we could vaccinate 80% of eligible adolescents for this virus, it could prevent about 70% of cervical cancers.
Oh,
so it's pretty significant.
Yeah.
And cervical cancer is one of those cancers that affects women, and that when they have it, the mortality rate is quite significant. We also see that there are disparities by race and ethnicity when it comes to cervical cancer mortality, where Hispanic women and African American women are more likely, once diagnosed, to actually succumb to cervical cancer. So in some respects, you could also view this vaccination as one that, if everyone were equitably vaccinated, could actually serve to eliminate the disparity in cervical cancer rates by race and ethnicity, which would be huge. And also, I'd say, in addition to the racial ethnic disparity, there's also disparity by socioeconomic status as well. So families and women who are of lower income actually are more likely to be diagnosed and die from cervical cancer compared to individuals who come from families with higher levels of income.
This is kind of like a two-part question, but one, why do you think HPV is becoming more and more prevalent? Why do you think it's growing in number, and more people are being affected? Because you said 70 million right now. Why is this developing at such a high rate?
Well, some of the research shows that it's due to people having multiple partners. So even if they do get this HPV, we also want to encourage you to continue to practice safe sex measures. This doesn't give you a pass. It's just really to protect yourself and hopefully your partners in the future from this particular virus, which can lead to these particular cancers. But really, it's just kind of how we have been practicing certain behaviors, which we believe has led to this outbreak.
And I will say on that note, in terms of not getting a pass for behavior and having to engage in healthy practices, another concern people have had about this is that it would give women the sort of signal that they don't need to have their annual pap smear. And that's an important point that I think we should emphasize, is that, you know, the preventative care that we engage in annually, such as our annual checkups, which would include a pap smear, still is important to have, still is required, even if someone is vaccinated for this vaccine, because it doesn't, you know, it does not address all strains of the virus. So we still have to get our screening for cervical cancer.
That's a great point.
Right, and what we know in public health is if we can prevent as much as possible, the amount spent initially to prevent a disease or prevent a cancer, the benefits far outweigh what the costs are and the pain to the family and the individual and to society. It's significant, so we're really, really appreciative that research has gone into this particular preventative measure, and we want to advocate for it.
It seems like it's going to help so many people. And kind of the second part to that question is, you had mentioned cervical cancer being a major cancer that's caused by HPV. Is there a correlation then on the rise of HPV and the rise of cancer such as cervical?
There probably is. I think there's definitely some relationship. We can't, you know, from the available evidence, we can't really kind of explain all of that, but there is a relationship there. And you know, as Director Gordon mentioned, there's also the relationship between HPV and HIV, and you're seeing more cases of comorbidities with these two conditions as well.
We'll have a lot of information on the screen at the end of this segment that parents can look at, and even youth can look at and learn themselves.
I was going to say, is there any place that in particular that people should look for more information regarding HPV?
I would say make sure, well, my first recommendation would be the Centers for Disease Control and Prevention, and we'll have that information available so that people can call or investigate online. Stay away from other websites or from non-scientific, non-reputable websites, because there are many people who have blogs that are covering HPV, people who are against the vaccination, or would certainly make a relatively convincing argument that you should not have your children vaccinated. So always consider the source of your information and make sure that it's a really reputable source. So I'd say if you stick with the CDC, you probably would get the latest information available.
Check the Cleveland Department of Public Health's website as well. We'll have a lot of information there too.
Thank you so much, ladies, for being here.
I'd like to say one more thing.
Oh, yes, Doctor.
Yes. So do I think, what's my recommendation? If it's not already clear, you know, I would say, I mean, speaking from a professional perspective and from someone who has small children, I would advocate that you should vaccinate your children. It's a rare opportunity that we have to prevent cancer, to prevent multiple cancers, and I think we should do that. You know, ask yourself, if there were a vaccine for HIV that could prevent HIV in your child, would you have them vaccinated? If there were a vaccine that could prevent them from ever, you know, being diagnosed with heart disease or having a stroke, exactly. Would you administer this vaccine, even if there were some potential side effects that are relatively minor? Would you do that? And if the answer to those questions would be yes, and I would think that most people, if they could prevent their child from developing breast cancer or any of the other conditions that we commonly think about, they probably would take advantage of that opportunity. I think it's a really important thing to think about, to talk to their doctor about, talk to their family about, but really become as educated as possible. But my recommendation would be that they probably consider very strongly having their children vaccinated.
Cleveland is very fortunate to have Dr. Hooper here. She's a recent transplant from warmer climates. So we are really fortunate to have her and her expertise here.
Yes. Well, welcome to Cleveland.
Thank you very much. It's very great to be here.
Thank you. Thank you again for being our guests today. And thank you for tuning in to Healthy Cleveland. Again, we'll have information on the CDC. And stay tuned for the next episode of Healthy Cleveland. I'm Leah Haslett.